So I want us to talk about types of exercises. Therapeutic exercises may include aerobics and endurance conditioning and reconditioning, where you're doing a lot of cardio workouts. Cardio workouts will help to strengthen your cardiovascular system and also your breathing system, where you're able to get enough oxygen into and out of your muscles. Another thing, there's agility training, there's body mechanics training, where you're trying to remind the body or the muscles which have atrophied what they're supposed to do and the kind of work they're supposed to do. There are breathing exercises, like the time of COVID 2019, there was a lot of respiratory problems, so most people faced a lot of breathing. So there are some few exercises that would really help people with breathing, and these exercises do help also to release tension in your in your shoulders and also in the chest area. There's coordination exercises where there are people who lose balance. So you help them with coordination. You're teaching them how to coordinate their muscles and how to move their muscles. There's development activities training, where you're helping people in terms of development. Maybe they've lost function of some muscles and you're trying to develop the memory back to the muscles. There's movement pattern training, where you're training people how to move. There are some people who lose movement on time. Somebody who's passed through a stroke loses functionality of either one side or both sides of the body. So you have to keep training them. Usually they are motor movement, the neuromotor movement, where you're training both the nerves and the muscles how to function and how to move. There is range of motion exercise and soft tissue stretching, where you're stretching the muscles to create a better range of motion, and also you're stretching these muscles to have better ease, so that as you're moving them, there's a better range of motion. There's strength, power, and endurance exercise, where you're teaching people how to have strength in their bodies. Most people have bodies, but they don't know the kind of strength they have. Somebody just understands the weight, but they don't understand the strength that they have with their weight. So with these exercises, they help you and teach you how to strengthen these muscles, how to recondition these muscles back. So as you function them, you're able to feel each and every one of it. The most common exercises have four groups. The first group is strengthening exercises, usually performed with heavy resistance and fewer reception. So mostly this is workout in the gym, where you're using dumbbells, barbells, and also you're using weight training, where you're using your strength to push the weights that you're functioning with them. There's endurance exercise that engage large muscles group over a long period of time in areas of 50 to 60% of oxygen maximum to achieve greater cardiovascular endurance. So this usually works with people who run. So the runners usually go to a higher level of oxygen areas, and they're able to create endurance level where they're running more than 3 to 4 hours. You're able to run more than 40 kilometers still, but also able not to feel pain or feel like your muscles or your body cannot function at all. So with this kind of endurance exercise, your body performs better because you have stronger bones and lesser muscles to hold the bones, and this helps to create more increase in your oxygen levels. This flexibility exercise achieved through stretching and movement, e.g. yoga. Usually people do a lot of yoga stretches, which helps to identify areas that needs to be stretched more than other areas. Balance and coordination exercises that focus on maintaining and individual centric of gravity. So this one works with calisthenics. Usually people who do calisthenic movements, where they are gripping and they are lifting their bodies and they are moving their bodies in different directions. This is the kind of exercises that they do. So all of these are combined into exercise programs that work with many different types of patients. So if each and every patient has a different way of exercise, there are others who are not able to do endurance exercise because they cannot run. They may need strength training. Others may need, first of all, stretches before they do any endurance exercise. So depending on what the client is passing through, we usually help and guide the client on what they're supposed to do, and this one helps to guide them along the way to create a better lifestyle in their life. All of these are combined into exercise programs that work many different types of patients. Different subtypes of exercise can help to increase effectiveness or allow participation of individuals with special needs. So somebody like with CP, there is a different form of exercise that we can do. Somebody who has a scoliosis, where the spinal cord has a different curve, there's special exercise that we're supposed to do with them. So it's a really great expansion where we are really trying to work as a therapy company. Apart from a therapy company, we're trying to involve and create awareness on people on what exercise therapies and also movement therapies can do in their lives. So that as they continue to progress on getting better with their pain and pain management, they are also able to create awareness and understanding and create better knowledge of how they can create a better lifestyle to themselves and also to the future generations of what we have. So this is the Healing Clinic, Massage and Therapy Center, where we make therapy.